Reopening was a big risk. We knew that. It was a political and economic calculation and not a medical calculation. I have for you now just a summary, a look back of what went into it.
I can tell you on COVID or coronavirus or whatever you want to call it, plenty of names, tremendous progress is being made. I spoke with the governor of Texas, where they've done a fantastic job. He's got it in great shape, Texas. Florida's doing very well. Numbers are actually going down. You look at Florida, the state of Florida, did a great job. The numbers are going down very substantially without question. I mean, very powerfully going down. You look at Florida, they've been open or very substantially open and pretty much completely open in some cases. The job the governor of Florida has done, it's incredible. The numbers they're doing, you've got to open it up. We're doing record numbers. We're doing numbers like nobody's ever seen before, actually. We've made every decision correctly. We've made tremendous progress. We did the right thing. Now we open. We got to get it open.
Doctor, he's right about one thing. We're doing numbers nobody's ever seen before. Again, what did they expect?
Good to see you, Brian. Let me start here. Just nomenclature on testing. What matters here are the number of tests per confirmed case. We can talk about aggregate tests all we want. It doesn't matter. I'm a doc. I was just in the ICU. I still do not qualify for a test, even though I was caring for patients on ventilators with COVID-19. Our tests are still narrowly focused on those who we think are symptomatic or who we think are highly likely to turn positive, which is why the number of tests we do per confirmed case is around 12. You know what Estonia does? They do 52 tests per confirmed case. Taiwan, about 90. South Korea, about 90. New Zealand, which has figured this out, 270 tests per confirmed case. That's what matters. So for your viewers out there, don't get distracted by what the president or the vice president says. Look at facts that matter. We are narrowly testing. And then yesterday, the president decided to pull funding for community health sites that are doing testing. Underserved areas, communities of color, places where we need to know what's happening. He pulled funding for that. So we're not going to have funding in 13 sites that are critical, places in Texas that's going through an outbreak. So, Brian, there's lots of explanations here, but if I may, speaking to the states, the nation's governors, mandate masks, just like you mandate a ban on indoor smoking. Let's stop with indoor dining. We know there's enough data now suggesting indoor dining is a super spreader event like Tulsa, the Tulsa rally. Let's focus there. Let's increase testing. And for God's sake, let's get some dialysis nurses trained up. Let's get portable ICUs triaged in places like California and Houston. That's what needs to happen. And we're looking to governors to lead because we know the president won't.
Dr. Gupta, I was just going to say another thing Americans don't like hearing is we may not be allowed to fly to Europe. When you look at the chart of what the EU did and has done, and you look at our chart, the blue line, heading up, trending upwards. I'd love to know, what did they do? What, for that matter, did New York City do, which on its best day seems like an ungovernable mess most of the time?
We had strong leadership, Brian. That's the common denominator. New York City and New York State and Washington State, strong leadership. Across the EU, paradigms of excellence when it comes to strong leadership. We have 50 different road maps here in the United States. Governors are have to go their own way. So when you have 50 different approaches, you're going to get 50 different outcomes. Unfortunately, we've gotten a really bad one. To Jonathan's point, there's no patience for social distancing, but let me tell you what there's less patience for: failed leadership. Doctors, nurses, respiratory therapists across the country, we are all clamoring. People are going to die in ICU beds that don't exist if we do not get straight quickly. The answers are before us here. Mandating masks up front, that's obvious. That's low-hanging fruit. We've talked about testing. We need to be serious about what a lockdown looks like. Outdoor dining only. Otherwise, we're going to a full lockdown.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.